This week on Healthy Living, we take a close look at mental health in Africa. And what is post-traumatic stress disorder and who is at risk? Nigerian Clinical Psychologist Dr. Labeebah Sa'id Ibrahim shares some insight. Plus, the World Health Organization launches a suicide prevention campaign in Africa on World Mental Health Day. Finally, we'll have some strategies to improve your emotional health. That's in this edition of Healthy Living. Hello, I'm Linor Moudou. Welcome to Healthy Living. Post-traumatic stress disorder, or PTSD, is a disorder that develops in some people after experiencing a scary, dangerous, or shocking event, such as a death, a car accident, or a sexual assault. According to the U.S. National Institute of Health, almost everyone will experience different reactions during trauma, yet most people recover from those symptoms. PTSD may be identified in those who continue to have issues such as fear or stress, even when they are not in danger. PTSD is debilitating, and symptoms involve chronic severe anxiety, flashbacks, nightmares, aggressive behavior, and reduced social life for many patients. Experts say individuals with PTSD are more at risk of suicidal thoughts, suicide attempt, and death by suicide. Data from the Institute Neuroscience Research Australia shows that nearly 4% of people in the world suffer from PTSD. Observers say in some parts of Africa, conflict, displacement, and other disasters leave people severely traumatized, and many experience PTSD. However, many people in Africa associate mental illnesses with evil spirit. Let's go to Ethiopia, where reporter Aster Misganar from Bahir Dar, Ethiopia, will show us how poor mental health awareness affects patients.
About a year and a half ago, Worknesh Ewenetu was working at a construction site in Bahir Dar city. One day she got involved in a fight with two of her colleagues. After that incident, Worknesh started developing feelings of hatred towards them. Then one day, a close friend told her that those people could physically hurt her.
After I broke up with these two colleagues and I heard rumors that they could hurt me, I started to stress out, couldn't sleep, and eventually I couldn't control my mind. I couldn't trust anyone. I was crying and developed a habit of insulting people.
Worknesh's parents thought traditional medicine would cure her from her illness.
Initially, my parents took me to the holy water. When that didn't work, they took me to another person who said he knows traditional medicine, but then my situation started to escalate.
After trying different healing methods without success, she finally decided to visit a medical facility. Worknesh says this last attempt put her on the path of recovery.
Finally, I came to the hospital. Once I came here, the doctor started to talk to me, and gradually I started to feel free.
A psychiatrist at Filije Hiwot Hospital in Bahir Dar city explains what PTSD is.
Drought, displacement, conflict, when all these things natural or man-made happen, either separately or together, it will create stress and eventually cause post-traumatic disorder. People with this case display sleeplessness, always being on guard for danger, not trusting people, trouble sleeping, concentrating, and develop new behavior.
In Ethiopia, people who are suffering from mental illness or post-traumatic stress disorder are usually considered to be possessed by evil spirits. Dr. Mateo says due to the current conflict that the country is facing, PTSD is increasing. According to the research conducted by Amhara Region Health Bureau of Ethiopia, over 4,000 people are affected by PTSD since the war broke in 2020.
For more on post-traumatic stress disorders and addressing mental health in Africa, we spoke with Dr. Labeebah Sa'id Ibrahim, clinical psychologist in Abuja, Nigeria.
PTSD is a mental stress-related disorder that is triggered by a terrifying event. So it could be an accident, it could be loss of a loved one, just any event that causes trauma to the brain. So it doesn't necessarily have to happen like instantly. Sometimes PTSD happens after a while. It could be after years, it could be after months, it could be after weeks. It's as a result of any terrifying events like I mentioned. So I could go through a life-threatening accident and I would end up developing PTSD. I could lose a loved one. So that inability to cope or grieve well could cause PTSD for me. It could be separation anxiety that could lead, I'm separated from a loved one, so it doesn't even have to be dead. Sexual abuse, domestic violence, these are events that could lead to PTSD. There are different symptoms. It could be panic attacks. It could be having flashbacks. It could be having severe anxiety. It could be having terrifying dreams about those events that has happened. So the first line treatment for PTSD is psychotherapy. And the second line treatment is pharmacology, uses of medication. So it depends on how severe the PTSD is. If it's something that could be handled without pharmacology, then psychotherapy would do just fine. If it's very severe, then someone ends up, mixing psychotherapy and pharmacology as well. It can be cured. But for most mental disorders, you realize that there's likely a high chance for relapse, because once you're exposed to your triggers, then there's likely a high chance that there would be a relapse. But as long as you're able to, work on your coping skills, you're able to identify your triggers, then you find yourself staying away from reasons that would make you relapse. If you realize that you're having these symptoms I mentioned earlier on persistently and consistently, and these things affect a certain aspect of your life, it could be work life, it could be interpersonal relationship, it could be your social life, then it's time for you to seek for help.
What do you know about a post-traumatic stress disorder or PTSD? Have you or anyone you know experienced a traumatic event? If yes, how did you take care of it or your mental health to get over the trauma? Here are some reactions from Nigeria and Mali.
Trauma comes in different ways and degrees. I believe that almost losing my life and the life of my one-year-old baby in a car that burst into fire where we were on transit between Lagos to Akure was, I would say, is my most traumatic, experience ever. And I remember for months, this happened maybe 9 years, 10 years ago. And for months, I could still remember that I have nightmares. Yeah, for me, I think what helped me first and foremost is my faith in God.
Post-traumatic stress disorder, I think it has to do with going through stuff like trauma or going through something, maybe a heartbreak or a kidnap, and then when you come back home, what you go through after that, what you experience, what you feel after the whole thing, that's what it means.
I know something about post-traumatic stress because I was once a victim in 2008 during a trip. Our train had a collision with the freight trains. During that night, there were 6 deaths. At that time, I was studying medicine, so with the death, the serious injuries, it was not easy for me. It took me a long time to get over it.
I think one of the ways you should do that is for you to be around people, and then you should try your best to stop thinking about it, because it might end your life at some point. And staying alone brings a lot of stress to your mind, which is so bad. I think one of the best ways to do it is to stay around people, to be happy, and just forget about the past.
Now, the way you feel can affect the way you function in your professional and personal life. Here are some steps by the National Institute of Health to improve your emotional health. Get quality sleep. Sleep affects both mental and physical health. It helps you think more clearly, have quicker reflexes, and focus better. One step to improve your sleep is to go to bed the same time each night and wake up at the same time each morning. Strengthen social connections. Scientists say whether with romantic partners, family, friends, neighbors, or others, social connections can influence our biology and well-being. For example, join a group focused on a favorite hobby, such as reading, hiking, or painting. Cope with loss. Be patient. Mourning takes time. Finding a grief support group might help to take with others who are also grieving. Reduce your stress. Set priorities in accomplishing tasks. Decide what must get done and what can wait. Exercise regularly. And finally, talk to a mental health professional if you feel unable to cope, have suicidal thoughts, or use drugs or alcohol to cope. A global report says nearly 1 million people around the world are diagnosed with a mental illness, yet they and many more are suffering in silence because they fear the stigma associated with psychiatric disorders. The report from researchers in 40 countries around the world has been released to coincide with World Mental Health Day. Take a look.
The new report is called Worse Than the Condition Itself. That's because people suffering with mental illness told researchers their silence and fear of discovery and the stigma which would be attached to them was worse than suffering in silence.
This year, across the world, are about 970 million people in those categories. About a third have depression, about a third have anxiety, and then there are a range of other conditions. For example, about 1% of all the population across our lifetimes will have schizophrenia. About 0.5% of all of us will have bipolar disorder.
Published in the medical journal The Lancet, the report reveals that people everywhere with a mental health illness fear stigma and prejudice.
But if you have a mental illness which has an effect on the way that you think and that you believe things, it's much harder to find the capacity and the confidence to describe well to somebody what it is you're experiencing. And that's why you begin to have that prejudice and that misunderstanding and that tension that exists in families, amongst employees.
The researchers say in many countries where there is poverty, there is no treatment available. And in some countries, psychiatric treatments are unheard of. They say the types of stigma people may suffer varies from region to region, such as being denied the right to vote, to get married, or to inherit property. There have been some progress made in addressing mental health, but more needs to be done.
I think it's true to say that when it comes to issues like depression, anxiety, we have lots of public figures who are talking openly about their mental health, and that's a great thing. After all, in any given year, 1 in 4 people will experience a mental health problem. But complicated, serious, enduring mental illnesses like schizophrenia, which are much more difficult to understand, I think there is still a level of public discrimination, public stigma, and that's where I think we probably haven't seen quite the development that we have for those more moderate illnesses.
The report reveals that there was a 25% rise in the prevalence of depression and anxiety in the first year of the COVID-19 pandemic. The researchers call for action to end what they say is stigma and discrimination against people with mental health conditions worldwide.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linor Moudou. Until next time, stay well and strive to make every day a healthy day.